All right, folks, I am back and we'll begin to share my desktop again. We just talked about that. So let's now get into, uh-oh, let me go back. Oh, no, not what I want. That's what I want. So the next topic we will take a look at here is what we refer to as non-therapeutic communication. And you guys probably had some of this when you took mental health. So just take a look at these, changing the subject. When you're having a discussion with someone and you're changing the subject because it might be uncomfortable for you. You don't want to do this because it is considered non-therapeutic for our clients. Offering false reassurances. Oh, you'll be all right. You'll be all right. Surgery will fix this right on, or maybe medication, or some false reassurance. You want to avoid that. Being fatalistic, essentially not offering the patient or the client rather much in the way of hope. All right. And also avoiding the client, not going in the client's room, just avoiding them, avoiding the conversation. Um, all non-therapeutic, something we certainly want to stay away from. All right. Now, these are some of the therapeutic communication um, things that we want to consider as we interact with our clients. I'm so used to saying patients, so excuse me, I may kind of um, do a misstep every now and then with that. It's one of those ingrained things. Of course, over the years we've went from client to patient, so I suppose it shouldn't be too difficult. Anyway, so these are some of the therapeutic communication concepts. Attentive, active listening. Um, Also, silence. Sometimes silence is a little uncomfortable for us, so don't allow yourself to be uncomfortable. Um, Allow silence. No one wants someone who just continues to just run their mouth. Um, Silence allows time for reflection for both the client as well as yourself. So don't hesitate to incorporate some silence as you engage and interact with our clients. We want to use open-ended questions. This will allow them to speak more, to expound more on their issues or concerns. Exploring is another therapeutic communication. Clarification, paraphrasing, as well as summarizing. And this indicates that you're really listening, that you're really trying to find a solution, that you're really trying to delve into what is the concerns for your patient. And actually, um, I should have been clicking on my PowerPoint. There we go. So those are all the therapeutic ways to communicate with our patient. 35, 55. All right. Now, when you get a chance, go ahead and I won't play the video now, but when you get a chance, go ahead and take a look at this hospice YouTube video. We will be learning the difference between hospice and palliative and respite care. So take a look at this and we'll explore these concepts a little more as well. But I will let you guys go ahead and take a listen to hospice care. All right. And there's also a video on palliative care as well. So take a look at that one. We're actually moving along pretty good, actually. And the next one, take a listen to this video, which is respite care. And for those of you who do not know, respite care is essentially giving the caregiver a break. Someone is taking care of someone 24/7. We have to be concerned about the mental health, the physical health, the emotional health of the caregiver as well. As you can imagine, not having a break from anything, especially something as intense and so involved as taking care of someone as they go through that the dying process, can be very weighty, if you will. All right. All right. So this is a table that I want you to take a look at when you get a chance. Want you to be able to compare the differences between hospice care, palliative care, and respite care. So, for example, for hospice care, the terminally ill, those who are terminally ill, they usually have less than 6 months to live. All right. Um, palliative care, palliative care, does not have to have a terminal illness. They may have an illness where they're just suffering a lot. They're in a lot of pain, a lot of discomfort, and their palliative interventions is what we do to provide support, um, relief of symptoms, relief of pain, if you will. They've actually found that even people who are in hospice, sometimes family members or the patient does not want to go into hospice because that kind of has a finality to it. And they might choose palliative care over hospice care. And these patients tend to live a little longer. I mean, you can imagine if someone um, essentially has a significant pain, and you have this pain and you're getting this pain under control, and so the body is going through less stressors, if you will, because we know what stress can do to the body, especially during illness. It wreaks havoc on the human body, and therefore providing them a kind of relief might extend their lives. I mean, at least that's what the studies have said. Now, as far as respite care, it does not have to have a terminal illness. Again, it could be someone who's terminally ill, or someone who has a significant medical concern where they're suffering, and the caregiver is there almost 24/7, and they need a break. Some home care agencies does provide this service or do provide the service. And I believe in payers, which are your insurance companies. I believe they do pay for that. Now look at the next line here: family centered. Both hospice and palliative care is family centered. But now look at hospice, or rather respite care. It's more caregiver centered. All right, because the focus is on the caregiver, giving them, again, a break. Now, take a look at the hospice care. The next line here is multidisciplinary approach, consisting of the physicians, nurses, as well as the clergy. Palliative, again, multidisciplinary approach, consisting again of physicians, nurses, and also therapies that can bring about that relief that these patients, these clients, need. So respite care, now take a look at this one. Volunteers, there are some volunteers, maybe someone from a parish, right? There's home health agencies, as I mentioned. A hospice nurse can also provide this service, as well as an adult daycare. All right. And the last one is on the hospice care, not receiving curative treatment. The aim of this therapy is not curative. All right. However, for palliative care, they can be receiving curative treatment. The condition they have, they're in a lot of pain and suffering. but they have a fairly good prognosis. They can be cured, and essentially, but they need relief from their symptoms. As far as respite, they may or may not be receiving curative treatment. All right, so just make sure you all know these differences and know them well because you might be testing on them. All right. So let's kind of go through some NCLEX questions here. Let's see if the light bulb will go off in that brain of yours. So the first one here, a client has a terminal illness and is discussing future treatments with the nurse. The nurse notes that he has not been eating, and his response to the nurse's information is, "Why does it matter?" What is the most appropriate nursing diagnosis for this client? I give you just a moment to think about that before I give you the answer. See if you guys came up with the same. All right. So the answer would be B, hopelessness. The client is hopeless. All right, let's look at the next one. The family of a client with a terminal illness wishes to be able to help provide some psychological support to their family member. What will the nurse include in the teaching plan to assist the family in caring for the family member? Give you a moment to think about that. Is it A, demonstration of bathing techniques? Can it be B, application of oxygen delivery devices? All right. Can it be C, recognition of the client's needs and fears? Or can it be D, information on when to contact the hospice nurse? What do you think? All right, so did you guys see that silence that I incorporated in my teaching? I mean, even in teaching, we have to practice silence. Don't be so quick to just want to just talk, 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 talk. Silence. Allow both parties to reflect, if you will. So the answer here will be C, recognition of the client's needs and fears. All right, so the next question, a client who is receiving chemotherapy on a medical unit due to a recent diagnosis of terminal cancer of the liver has an in-depth conversation with the nurse. The client says, "This cannot be happening to me." You already see it coming, right? What Kubler-Ross stage is this client displaying? What are they exhibiting here? Is it anxiety? Is it denial? Is it confrontation? Is it depression? Now, of course, we know that anxiety and confrontation was no, and this is the way you need to think about when you're taking your tests. We know anxiety and confrontation was nowhere near or in those stages. And so ask yourself the question also, was depression also in those stages? So the only viable response here will be dun, 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 denial, B. B is your correct answer. All right. Now, um, The next question is, the nurse is providing care to a dying client. What is the nurse's primary concern? All right. Is it to promote optimism in the client and be a source of encouragement? Promote dignity and self-esteem in as many interventions as is appropriate? Allow the client to be alone and expect isolation on the part of the dying person. Or can it be D, intervene in the client's activities and promote near normal functions? What do you think? What do you think? Incorporate a little silence here. All right, so B is your answer. Promote dignity and self-esteem in as many interventions as is appropriate. All right, and the last question, there is a different focus for the client with hospice nursing care. The nurse is aware that client care provided through hospice is, all right, and remember that table. The table will help you guys out. Is it A, designed to meet the client's individual wishes as much as possible? Is it aimed at offering curative treatment plans intended for client recovery? All right. Involved in teaching families and/or caregivers to provide postmortem care? Come on now. Offered primarily for hospitalized clients for whom at-home care is not possible. So I believe the answer should be pretty obvious to you. And so we are going to go with A. It is designed to meet the client's individual wishes as much as possible. All right. So that is it so far. What we might end up doing, because I would like for you guys to take a listen to this particular PowerPoint voiceover, hopefully before you come to class on Tuesday, because in class we might go ahead and play this game, Jeopardy. All right, and this game should help you even more to keep these concepts much easier, if you will. So at this point, I am going to end this presentation, and I appreciate you listening. Some pretty good information that should help you all on your exam. So take a listen, think on these concepts and meaning, especially in your lives, and of course, what it means to your to our clients as well, their families. And as you incorporate these concepts, it will, of course, make you a much better clinician in the clinical practice setting. All right, folks, until next time, thank you.